So is everybody alive and well today? Yeah? Oh yeah. Y'all are so nice. All right, so now is the time. If you've got your phones out, put them in your pocket. I've got to get off that crack. I'm going to get stuck again. If you've got your phones out, put them in your pocket. All right? I think you're going to be using them again in the very near future. So, before we get started, I want to have all of our instructors to please stand up and be acknowledged today. Let's give them a round of applause, please. They are fabulous. We've got some in the back. Thank you all very much. Okay, so a little bit of housekeeping. I have a big question. So this morning I sent all of you an email that said, reminder about class today. Did anybody get it? Okay, got one check in here. Thanks. Okay, while she's checking, I have a very important question. How many of you are going to the concert tonight? A few hands in the air. Kenny Chesney? What? And the band Perry? Thanks. I had that going in my head. I was like, oh my God, what's the name of that group? So the other thing I got. Jennifer Nettles. Sugarland. I don't know. Is that right? Yes, yep, good. So she's singing the national anthem at that some other ball game tomorrow that we don't talk about. Here's the really important question. How many of you are tailgating with me next Saturday at Bristol Motor Speedway for the ETSU Western Carolina game? I was trying to avoid that. Yeah? Oh, come on. Okay, so when's the next ball game? The next Saturday? When's the next home game? Is there a break in between? Okay, so the first game at Kermit-Tipton Stadium, there will be, I think there may even be for next Saturday, a bus leaving from campus that will carry you up to Bristol. Do we have anybody that lives outside of East Tennessee? You might not value my accent if you do, because I'm Eastern Tennessee. I don't know where that is coming from. People are calling us Eastern Tennessee more and more, and I don't know what that's about. Okay, so football, I hope you all will come tailgate with us. We are going to be at the Academic Village at Kermit-Tipton Stadium. Kermit-Tipton, that's a mouthful. Kermit-Tipton Stadium over at Science Hill, our next home game. Okay? So I hope to see you there. Yell at us. I'm sure you'll see some of the instructors there, in and out, different people. Your faculty advisors will be there. Obviously, our president will be there, Dr. Noland. If you don't know Dr. Noland, he always invites you to walk up and introduce yourselves. I encourage you to do that. He is so awesome. He really is. He's full of energy, a ball of energy. Speaking of energy, we have Paula Masters with us today. Paula has come to talk with us about the College of Public Health and the programs and departments within. It's all you.
Okay, can you hear me? Awesome. All right. So, oh God, I'm loud. Hold on. Is this better? Do you feel like I'm yelling at you? Okay, good. Good. All right, so like Martha said, my name is Paula Masters, and I am the Assistant Dean for Student Services for the College of Public Health. But if you will indulge me, I'm going to give you a little bit more of my background, so that way when I'm up here and I'm talking about public health, is that it comes with a little bit of credibility. So I came here as an undergrad. I am from extreme rural Appalachia. I came up here to go to school, got my bachelor's in public health, went straight into practice. So I started out on the local level in health department. I was a health educator. Did that for a couple of years, was lucky enough to get a promotion, and then started overseeing all the health education and health promotion for Northeast Tennessee. And then from there, got to meet and start working with some really great folks here in academia. At the same time, I got my master's online. Got to come here and start running a statewide training center. So what I did was I started going across Tennessee and started training in public health to make sure that the workforce was competent in what they were doing, so that way we were better servers of the public's health. Then from there, I went ahead and started the doctorate program, in which, praise God, I should be graduating in May. I need you all to yell and say that that's great. Thank you. Yeah. Thank you. And from that, then started getting into really student services, because what we started seeing is that to go out and train professionals that were already practicing, is that why weren't we doing that more intrinsically? In that we were taking what we were learning, taking what we were seeing, taking what we were doing, and actually infusing it much more in the classroom, so that we started growing professionals day one. So that's just a little bit of my background. But we're not here to talk about me today. We're here to talk about public health, all right? So with that, I want you to know this is very informal. I appreciate questions, comments. I'll even take jeers. It's all right. So we're going to go through, like I said, it's going to be informal. I have a lot of videos because I don't think that you want to hear me the whole time. So I have a lot of videos. But first off is that one thing that we see is that most people really don't know what public health is. So how in the world do we start and open that conversation? So, what do you think it is? Oh, come on. I know it's Friday afternoon, but somebody take a stab.
The health of the public.
Woo! Health of the public. That's right. Bottom line, I am loud, sorry. Yeah, anybody else? Health of the public. It's in the name, people. Anything else? Is it more than that? Is that it? If it's the health of the public, then what goes into that? Health care. All right, what else? Health education. What else? Providing the tools necessary. What else? And we're done. All right, I'm going to walk off stage. We're done. No. All right, so public health is, some people think it's this, science and art of promoting. Some people like to put it in a little pretty diagram and start talking about the holistic nature of public health. Then some really smart people started putting in boxes and arrows to make it pretty. We've done this to ourselves, we've done this to ourselves, and we've done this to ourselves. All to make it just seem really disjointed, like nobody really knows what public health is. This, anybody walked into Lamb Hall? Anybody? All right. What's the first thing you see when you walk into Lamb Hall? The big quote on the wall. Have you ever stopped and looked at it? What's it say? It's the definition of what we say public health is. Whoop! There it is. Health is a complete state of physical, mental, and social well-being, and not merely the absence of infirmity. A lot of times we think that health is just not having disease. That's not what it is. It is a complete state of. So, our dean is Dr. Randy Wyckoff. Anybody met him, talked to him, saw him? Anybody? Are you getting ready to hear from him? This is what the dean says is public health. Please work.
Hello, this is Randy Wyckoff, the Dean of the College of Public Health at East Tennessee State University, and I'm here to answer the very important question, what is public health? Well, the Institute of Medicine defines public health as what we as a society do collectively to assure the conditions for people to be healthy. And that's a great definition, but what does it really mean? The way I like to think about it is this. Think of all the things that go into being healthy that don't have to take place in a doctor's office, a hospital, or a clinic. Let me give you a few examples. For example, who investigates outbreaks? When there's a disease outbreak, a foodborne outbreak, who are the disease detectives? Those are the epidemiologists and the microbiologists trained by public health. Who are the folks who prepare communities to respond to disasters and coordinate the response to those disasters? There again, those are folks trained in public health. Who really understands the environment and the threats that the environment poses to human health? Not the theoretical issues, not sort of the advocacy for the environment, but really understanding the science of environment. Those are our environmental health people. Well, how about global health? Who are the folks that take these concepts and translate them internationally? The folks who understand that the issues that can improve health in one country can improve health around the world. Those are folks trained in public health. What about the folks who understand that the leading causes of death in America today are behaviors? Who are the folks who help kids not develop bad habits and help adults quit those habits? Those are folks trained in community and behavioral health and other aspects of public health. But there are even some parts of public health that you may not think about. When you go to the doctor and get treated for a pneumonia, how does she know what antibiotic to give you? Because someone has conducted a systematic clinical trial. And the design, the construction, the carrying out, and the analysis of clinical data are often done by epidemiologists, biostatisticians, and microbiologists and other folks trained in public health. And what about the most efficient and effective use of healthcare resources? Who are the folks who really understand and study health policy and health leadership and health management? Those are the folks trained in health services management and policy and other aspects of public health. I like to define public health as evidence-based altruism. Evidence-based meaning we use science. Altruism meaning we care for people. It's the folks who understand that there are a lot of health challenges in the world, but these challenges can be addressed. And we're very fortunate that every year hundreds of students enter this field because at the end of the day, when those students are trained, they become public health. It's an incredible field to work in. I've had a great career, and I think you will too. If you have any questions about public health, feel free to give me a call or write me an email.
It's not going now. Sorry. It's not working.
If you have any questions?
And I'm done. There we go. All right. So that was what our dean said is public health. But there's so many other ways to look at it. He can talk about it. He can put it in these buckets, which is actually how our college is structured around different disciplines of public health. But public health and ways to work in it and ways to contribute to it are all around us. This was a campaign that was released about 3 years ago. And what they did was to show just how far-reaching public health was, they wanted to go out and take it on the road and just do a sticker campaign. So what they did was they had these stickers, and all it said was, "This is public health." And what they did was look and see how many places you could place a sticker on that actually were public health. And this is just a little snippet of that campaign.
Public health?
Public health?
What do I think it means?
Good question.
I haven't a clue.
As against private health, you mean?
Hygiene? Hygiene.
I don't know.
I'm really excited about
about this sticker campaign.
Everybody can see that we're actually doing things everywhere.
So when people walk by, they'd be like, oh, this is public health.
Everything around you is public health.
The stickers will be like our voices constantly reminding people that this is public health, this is public health, this is public health.
By seeing these stickers, they'll see that we do a lot, and they'll see that they actually need public health to keep them healthy and to keep them well.
Hybrid buses in New York provide cleaner air for everybody.
Thank you.
If there's a bike rack, that means that more people are actually going to be riding their bikes instead of taking cars or taxis.
Let's definitely sticker that.
Having a fresh fruit stand like this encourages people to include fruits and vegetables as a part of their daily diet.
We're sticking it so people can see that this huge cigarette isn't good for them. The message is clear.
Water safety is a public health issue because if we don't protect our drinking water, then it can trickle down into the food that we serve.
It really helps people to pay a lot more attention to their nutrition and to the things they're putting in their bodies. It's public health right there.
Community health vans are a public health intervention at a community level, making sure that the aging population not only has access to certain services, but has transportation to get there.
My definition of public health relates to the environment.
Public safety.
Eating well.
Free clinics.
Sewers.
Washing your hands.
It's teaching safe sex.
For AIDS awareness.
No smoking is a public issue, yes.
Maybe air quality. Truth in labeling.
I think it has to do with your eating habits.
Educating the public about ways to improve their health and happiness.
Helping people with cancer.
Being on constant monitor of your own body.
Taking care of the citizens of our city.
Public health is about controlling the factors that you can't control that control your health. You're only as healthy as the world around you. Public health is your health.
Had you guys thought about all of those things being public health before? Would you have put a sticker on all that? Yeah? What else would you put a sticker on? Anything? Fire hydrant, okay. What else? If you think about just from where you park your car, or if you're walking here from your house or your apartment, on your walk to class, where could you place some stickers? Say it again. Crosswalks. Just streets in general. Built environment is all around us. That's very public health. What else? The emergency beacons. Absolutely. What else? Trash can. Anything else? Say that again. Hand sanitizer. What else? What kind of tower? Cooling towers. Okay. What else? Is there anything that you carry on your person that you could put that sticker? Water bottles. What else? If you're walking places, you could actually put it on your shoes. That's public health. That's exercise. Anything else? Okay. Let's see if we can get it to transition this time. Fingers crossed. All right. Before you actually came here to ETSU, you knew that you wanted to go into some sort of health field, correct? Mm-hmm. Was public health in your mind at any time? Could you have even thought about what public health looks like in practice? All the disciplines? Anybody who had thought about public health or even had been exposed to public health before they got here on ETSU campus, raise your hand. Very few. Very few. All right. So just a show of hands. Who all is wanting to go into nursing? Go. Okay. Physician? Okay. Allied health? Okay. Occupational therapy? Physical therapy? Veterinary? Okay. And now again, show me public health. Yeah. It's not something that is really communicated well. We've done that to ourselves. Public health has done that to ourselves. So when we go out and we're talking about what do careers in public health look like, that's hard for anybody because they haven't really seen it modeled, especially in rural areas versus urban areas. We don't do a really good job of communicating what is public health and what does that path look like. So I want to show you some options, and then we're going to talk about the ways that we help people get there in the College of Public Health. This is a longer video.
When I was 18, I had no idea what I wanted to do.
I don't remember really having any idea or even thinking about what I wanted to do when I was older.
I wasn't sure exactly what I was going to see myself in, but I knew that I wanted to go to college.
High school, when I was in high school, I had never heard of epidemiology. I had maybe barely heard of public health. Usually it's used in a negative connotation.
I wouldn't have known what a public health nurse was.
I didn't actually know it was quite possible to have the job that I have now.
I chose prevention because I want people to have the highest quality of life possible. My job is complex and it's diverse. My main responsibility is developing employee wellness programs for Franciscan Scamp employees and also for area business customers. And that means everything from consulting to program development, implementation to marketing, communication, program evaluation, outcome measurement. I spend a lot of time working very, very closely with my team of other health promotion consultants. I'm involved in every single aspect. There isn't one thing that comes out of my department that I haven't touched.
I coordinate a program that provides medical outreach and other forms of outreach to underserved communities. As a project manager, I'm responsible for keeping 20 balls in the air at all times. Most of my time in my role is spent at Gunderson Lutheran or in the La Crosse area, meeting with individuals, working on those administrative tasks in order for the program to operate smoothly. Occasionally I do have the opportunity to travel. I travel with the team, help be the liaison for the providers and the nurses on the team, and just ensure that the clinic operates smoothly, that the volunteers know what they need to be doing, working with the patients coming in the door, and just acting as an overall coordinator for the team.
I apply biostatistical concepts at the Gunderson Lutheran Medical Foundation in La Crosse. One of the things we try to do as researchers is improve outcomes of people. Another thing we try to do is simply shed light on what's happening with certain diseases. We monitor and we use statistics to do the monitoring. We can't come up with these kind of analyses that we do without technology. It's essential. I work with cancer studies that are geared towards lung problems. How long does a person live? Design is a major issue. How we design the study and what results we have to be conveyed correctly to our audience. One person said that I keep him honest. I kind of smile at that because it's kind of true.
I coordinate events for the Y. Some are adult focused, so like the Got Energy Triathlon that we have every year. I also organize many events for children as well, like a Hippity Hoppity Easter Boppity, a kids triathlon, and a Rudolph Dash. By getting sponsors and things like that, I get to go out into the community and meet a lot of our community leaders. From that, you're able to start coordinating, figuring out like your location, time, and place, getting some good people on your committee to help plan it, and then also just making sure you're reaching out and getting the word out there so people know of the event.
As a public health nurse, there are many different things that we do. We have many different programs. We work through the health department so we can provide services to people in the community. We work with children with special health care needs, maternal child health programs. We follow up with people who have been diagnosed with a communicable disease. We've been doing a lot of foot clinic. Another service that we do quite a bit is giving children immunizations.
One of my top job functions is to just watch the number of reportable diseases as it goes week by week, month by month, year by year. Epidemiology is all about the study of disease and how to stop it from happening. Every day can bring something different, actually, but my main job is looking at disease trends, causes of disease, and also I do emergency preparedness. A lot of my time is spent researching, looking at all sorts of different studies. There are a lot of good studies, there are a lot of bad studies out there, and part of my job is to figure out what's what.
In my position, I work with the tobacco prevention and control. I do child passenger safety, which is the car seat education. I also work with the healthy living collaboration, which has to do with nutrition, physical activity, and tobacco control. One of the first things I do is get my computer fired up and see kind of what's on the calendar for the day. I might have to do some grant writing, a lot of paperwork and reporting, looking over the activities that have gone on in the previous year and making it make sense for our funders. I might also be a part of a staff meeting. Some days I'm in the office all day, but many days I'm out multiple times. We do all different kinds of things in the health department, in the health ed division. It's really amazing. I think people don't have a clue the kinds of things that we do.
I always wanted to do something healthcare related, but the only thing that I really knew about was health profession type of fields. And it wasn't until I had gone on a trip down to Ecuador with a medical agency and was working with the local population in Ecuador. And it was through that experience that I realized health education can make such a huge impact.
I started off at UWL, and I was going to be a business major. I was taking some economics classes, and I just thought, this really isn't for me. So I took, in my second semester, a personal health class. Got turned on to the idea of health education and this idea that you could educate other people about health. And so I looked at other health careers. I looked at nursing. I had a good friend who was transferring to another school to become a dietitian, so I kind of looked at that and I realized, patient care isn't really what I'm about. And so then I met with Gary Gilmore, one of the community health education professors, and he was talking about this field of community health education where the community is your classroom.
I remember riding in the car with my dad, and I was like, we were just brainstorming about what to get into, what to do. If you like everything, if you like all kinds of stuff, what do you do? I didn't like math when I was in high school. I didn't like it. I never thought I'd do anything with math. I didn't really even know about statistics. What is statistics? I don't know. Didn't care. Eventually I reasoned math would be the way to go. It made the most sense. And I stopped thinking about, I'm not smart enough, I don't understand this. Look, I'm just an average guy, but what does that mean? I'm average, and that means I have the ability to reason, I have the ability to learn, and I can communicate, and I just have to apply what I know to something. It's simple. I knew what I wanted to do then, and I thought, that's what I'm going to do, then that's what I did.
When I first went to college, I was a voice performance major. I took that path probably out of a lot of pressure from a lot of other individuals. I got there, didn't perform very well my first semester of my freshman year, and discovered that there was a new major called Corporate Exercise Management, and it was relating to employee worksite health promotion or employee wellness. I knew instantly that's what I wanted to do, and I changed majors the next day.
I went to school for math teaching. So I was a teacher in Switzerland for 3 years at a boarding school. I coordinated many activities for the students. through this organizing and planning, I really developed a lot of the skills that were needed for this job. So I decided to come back to La Crosse and get a master's degree in public health, which is what I'm still working on.
As I got more into nursing and taking the course, like the nursing courses and not so much the generals, I knew that I wanted to be able to go out in the community and provide services rather than in like one location like a hospital nurse.
When I was in college, I took a class. I remember it was called Sociology and Medicine, actually, which is a lot of what is the background of epidemiology. And that kind of got me hooked. So then I looked for schools of public health on the internet. And when I went to graduate school in epidemiology, it all just clicked. I enjoyed what I did. I didn't have problems studying. That's how I knew that that's what I loved.
If you're in college and you're currently undecided on your major, if you're in high school and you're even considering working in the health field and your interest is more in education and prevention, I would certainly encourage you to look at UW La Crosse. They have a fabulous community health education program. It has many experiences and exposure as
Okay, so after watching that, how many of you have interacted, visited, been around any of those professions that you'd seen? Most everybody? Mm-hmm. Had you ever wondered what type of education or degree that they had when you were there? Would you have ever thought, oh, I bet you that's a public health degree? No. We usually, like people that are working in healthcare administration, we usually think, well, they have a business degree. Those that are working in some sort of clinical service, I'm sure that they have only a clinical degree. They don't. You have already said that you are a pre-health person. You are going to go into the health field in some form or fashion. That right there means that you care about the health. That means you care about your neighbor. That means that you want to improve the lives of those around you. So even if you don't get a degree in public health, you at some point are actually going to be practicing some form of public health because you are going to be working with others to improve health. Now, when it comes to public health and formal training, oh my goodness. There we go. All right. How actually do you get there? Well, it's the whole reason that the College of Public Health exists. You get an education in public health. This is some of the different degrees that we offer. So we have 5 departments: biostats and epidemiology, environmental health, community and behavioral health, health sciences, and health services management and policy. Epidemiology and biostatistics. Anybody ever heard of either of those before now? Yeah, a few of you, great. So epidemiology, you can think of it as outbreak investigators, disease investigators. That's usually, anybody seen the movie Outbreak or Contagion or heard of a little agency called the CDC? That's where epidemiology and biostatistics comes in. So the field of epidemiology investigates, evaluates, and monitors population health. Biostatistics is the dynamic field dedicated to the creation of innovative theory and methods to make that happen. That's why a lot of times you see those two things together in a department or in a discipline. In the College of Public Health here at ETSU, we have a couple of different degrees in epidemiology and biostatistics. We have a Master's of Public Health in Biostatistics and Epidemiology. We do not have undergraduate programs in epidemiology and biostatistics. Across the country, that's usually the norm. Undergraduate education in epidemiology and biostatistics is extremely rare. It usually, entry point is at the master's level. We have a doctorate of public health and epidemiology, and then we have 2 graduate certificates, one in epidemiology and biostatistics. So the Master's of Public Health is 43 credit hours. We actually have on-ground and online for epidemiology, 58 credit hours for the doctorate, and then 15 credit hours for the graduate certificates. I can't turn my head this way because the microphone's over here. And they both are offered online and on-ground. So what do you do when you have those degrees? You can go and work in a variety of different places. health departments, public health agencies. I just mentioned the CDC, hospitals, non-for-profit, and you can come into academia. Epidemiologists, median pay is about $65,000, and biostatisticians about $75,000. It's a real field that is growing astronomically, epidemiology especially. I can speak to our college alone, is that our incoming master's program, we just brought in the largest cohort that we've ever seen. We have almost 90 Masters of Public Health students, with the majority of those being in epidemiology. That's huge considering we're a college of only 800. So it's really, really, really growing big. About 10% over the next 7 years. Statisticians is likely to grow 27% over the next 7 years. So it's a field that's really, really growing. So here's some famous epidemiologists. I always throw these up here because you might have heard of them or you might be coming across them. So here's this guy. This is an Italian epidemiologist. Without him, we wouldn't have caught SARS like we did, and it would have been a whole lot bigger issue than it was. He was able to identify it, come up with a way and a solution to really mitigate the risk of that and save hundreds of thousands of people. That's one of the famous epidemiologists. This lady right here, Lane Clapin, she was a physician by trade, and then she went and got her doctorate of science. And she's the one that we can thank for having anything to do with maternal and child health. This is the woman that started it. Before that, there wasn't a true focus on maternal and child health. She also was the first one to look at and then take at the community level interventions around breast milk. So, pretty cool. Who we call the father of epidemiology, Jon Snow. Not that Jon Snow, this Jon Snow. Anybody Game of Thrones? Yeah, Jon Snow. All right, so this guy right here, he's the one that found out that cholera was what was going on in London, killing thousands of people. And he was able to do it because he was the first person to ever actually investigate in a way that then could be replicated. He found out that all he had to do to stop this section of London from dying was go and remove the pump handle where the people were getting their water. Bottom line, because he realized that it could actually be transmitted that way. That's the father of epidemiology. So, if you have any interest in being an outbreak investigator, disease investigator, epidemiology, biostatistics is the way to go. Environmental health. All right? This is another department, another discipline of public health we have. It's focused on health protection that is concerned with all aspects of the natural and built environment that may affect human health. Sorry, I know this is where Fridays really get boring when I start going degree. I promise it will get better. All right, the degrees in environmental health, we have a Bachelor's of Science, Master's of Public Health, a Master's of Science, and then a Doctorate of Philosophy in Environmental Health. Those are the credit hours. And then I want to show you this, to show you what environmental health can look like in the cutest way possible.
Hey! Oh! Did you chop down this tree?
No.
Who did it?
What's that? I think he did it.
Leave! Vacate the premises! Take your axe and get out!
And who are you?
What? I'm the Lorax, guardian of the forest. I speak for the trees. So you're telling me you just didn't see me magically appear out of that stump? With all the lightning and thunder and stuff? You didn't see any of that?
No, but that sounds amazing. Can I see some of that?
Yeah, I can show you. But that's not how it works.
Okay, didn't really happen. Oh, I know what you want. I've got one of these
for the cutest little guy I ever saw. Yummy, 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 yummy.
How dare you? Give me that. Well, I'm going to eat this, but I am highly offended by it.
Whoa! What? Hey, mustache, will you stop that? What's your deal, man?
Time for you to go, beanpole.
Pull him right out. Just gonna put him right back in. Do this all day.
Oh, stop right there. Stop it. So you'd hammer one of nature's innocent creatures.
What? No, I would never hit this little guy. You, on the other hand, I would gladly pound you and your mustache into the ground.
Behold, the intruder and his violent ways. Shame on you. For shame.
All right, you know what? That's it. You listen to me, you furry meatloaf. I'm gonna chop down as many trees as I need. Okay? Newsflash, not going anywhere. End of story.
So that cute little Lorax, he is your #1 environmental health guy. He cares about the animals, he cares about trees, he cares about the built environment, he cares about the water. So the question would be, are you a Lorax? We might have an instructor in our environmental health department that may even look like the Lorax. That's all I'm saying. All right? That is environmental health. The ways that you can work in environmental health, there's a number of ways. You can work at all different levels, federal, state, local. There is a lot of environmental health practitioners in the private sector. So anybody heard of a little business that's close to us called Eastman? Anybody? They have so many environmental health workers there. OSHA, TVA, all kinds of environmental health. Public health agencies, non-for-profit health policy. Environmental scientists are expected to grow by about 15% in this decade, and then at least 95% of the students that graduate find jobs directly. All right, health sciences. This is probably one that you're most familiar with. This is a department that offers a variety of courses around the human body and human health, microbiology, immunology, pathology, biochemistry, anatomy, and physiology. The degrees in health science, we have a Bachelor's of Science in Health Sciences, and then we have a Bachelor's of Science in Human Health. Both those have career paths and also paths to professional school, such as going into the medical field and veterinary and things like that. Graduates obtain work in laboratories. They also, like I said, go into professional schools. They analyze results. Median pay for just a microbiologist, not one that goes into the professional school, those that actually come out and go and practice microbiology, is about $70,000. Human health, same thing, those that don't go on a professional school in another field, but actually go in and practice human health and laboratory science, they look at about between 60 and 150. That's a wide range because that also takes into account your entry point. With microbiologists, this is what microbiologists think they do. This is what the parents think that they do. Society thinks that there are these people in spacesuits. Everybody knows that they come in a lab, and this is what they actually do. They get in there, and they really study and analyze microorganisms to really improve the health. All right, health services management and policy. This is knowledge and skills to manage and lead health organizations, develop, implement, and evaluate health policy. We have a variety of degrees in that. We have a Bachelor's of Science in Public Health with a concentration in health administration, a Master's of Public Health with a concentration of health administration, and then we have a healthcare management graduate certificate, all in varying hours. This is what most people think that hospital administrators do.
HCAP scores. I hate them with a passion. Here's the thing. This isn't a hotel. It's a battle station. We don't have time for turkey sandwiches. If you're not happy, go to the other battle station. I don't have time. Did you die? I'm going to ask you now. Did you die? If the answer is no, the patient satisfaction score should be 100%. Did you die? No?
No, I have not died yet.
Well then, why are we still having the conversation about HCAP scores? It is very simple. Ever since the imperial government decided to pay us based on HCAP scores, everything has gone to the dark side. Did you die?
So yeah, hospital administrators, they get a bad rap. They think that they are only concerned with patient satisfaction, but they do a whole lot more. Graduates with a healthcare administration degree, they go and work in hospitals, group practices, public health agencies, nursing or residential care facilities, other health policy organizations. Median pay for health services managers is about 88. Jobs for those are expected to grow by about 23%. Again, health policy and then the epidemiology, those are the two fastest growing disciplines of public health right now. And then our final department, community and behavioral health. This is the one that you saw when we were talking about health education, is that they seek to improve the health of individuals and communities through teaching, research, service centering around social and behavioral factors. We have a number of degrees. We have a Bachelor's of Science with a concentration in community health. So our Bachelor's of Science, those two concentrations are community health and then health admin. Master's of Public Health concentration in community health, doctorate in community health, and then we have two graduate certificates that fall under in this department, which are in rural health and gerontology. Graduates, again, work at all levels. They work at the local level, regional level, state level, federal level. They work in governmental and non-governmental. They work in private versus public. Median pay for health educators is about $37,000. So what do you notice about this one? Anybody see that this is the least paid? Community health is one of those that it is sometimes an absolute thankless profession. But without them, we wouldn't have half the knowledge that we have as a society. Because when in doubt, you ask a health educator. They do this, they dress up in funny costumes, they help to go out and work with kids, they come in into classrooms or do it out in the community, and they do it one-on-one. Health education is yet another great field. So, that's all of our departments. The other thing that I want to tell you about the College of Public Health is that we don't just operate here on main campus. We have an alternate campus that we run. So we have the Eastman Chemical Company gave ETSU a building. It's about 20 minutes from here out at Eastern Star exit, and it is called our Valley Brook campus. And what we do out there is pretty neat in that we took that space and we started thinking through how can we best support our students. And so what we realized is that in most of the other health fields is that at some point you will go through a simulation lab, whether you're simulating CPR, whether you're simulating dissection, whether you're simulating some sort of new treatment or protocol. At some point, you're going to go through a simulation lab. So why can't we do that in public health? Yeah, it's multidisciplinary, but there's got to be some way that we can bring that same experience and really up our training when it comes to students. So what we did was we took the space out there at Valley Brook and we created something called Project Earth. Project Earth stands for Employing Available Resources to Transform Health. And we do it in a way that is a little bit different than it's done other places, in that we ask you to build houses, play in the mud. There's ways of looking at how to bring clean water to places. And we do that so that way when you leave from that experience, because when you leave, it's not just about what you know, it's about what you can do. And so it's not just about you being able to communicate a skill, it's about you being able to have and show that skill. So that's what we wanted to do. I'm going to show you what some of the students were focused on doing this past summer. Out there, we take students through a number of different experiences. We have had them build shelters, we've had them build solar heaters, we've had them build compostable latrines, everything that you can think of. And we want to do that because it's not just that they can go and replicate building a solar heater. It's so that way they can actually think innovatively. They can think on their feet. If they're dropped in rural Appalachia or if they're dropped in Ghana, is that they can look at the situation, assess it, communicate with that population, identify that need, and then put something into place to help that community. And that's what we try to do out there. We are building a village as part of our simulation lab out there. It has different houses from all across the globe. We just finished up our third structure, and now we're going to start tackling a rural Appalachian community. And so that way, when we ask students, how would you go about making sure that residents of Rwanda don't lose any more children to open fires? Because that's their only way to cook. So now they can actually go into a Rwandan home and look at that and come up with that. So then that way we can go back there and communicate that and save those children. So that's what our village looks like. We do classes out there, and we also have, over the past 18 months, started to bring other groups out there. So I encourage you, if that's something of interest, let us know, and we can go out there and do some things. We've started bringing professional groups out there. We've brought members from Holston Valley. We've brought members from the legislation, all kinds of people to come out there, and they all see that it's not just going through and getting that skill set, but they also learn how to be a team, work together, conflict resolution, all kinds of different skills that you didn't even realize that you were getting, and you actually get to have a good time. So, I want to show you what that looks like.
Oh, dig those hoes.
Man, I'm tired.
With broken hands and withered souls, emancipated from all you know. You got to go and dig those hoes.
Oh, that's what we're doing. We're singing. Y'all know nothing about that. Watch me. Watch me. Come on. Prove myself. Dig it on, dig it. Dig it on. Dig it on, dig it. Dig it on. Two suits, two tokens in hand. I got no respect because I'm the new man. Got my shovel, shoes full of sand. Check out the tag, the name is Caveman. Dig it on, dig it. Dig it on. Like that shit? Dig it on, dig it. Dig it on.
Take a bad boy, make them dig 5 feet. The dirt in these shovels will give us a beat. Okay, you gotta find something never found before. If not, we'll just have to dig some more. Ooh. Na 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 na. Dig it on, dig it. Dig it on, dig it on, dig it.
So, did you notice how many bricks were on that house that they were building? Each one of those were made by hand. They did almost 8,000 bricks this summer. And that's all made from the clay and the mud and the grass and everything that's out at the facility. So there's a lot of blood, sweat, and tears that go in it, but a lot of satisfaction and a really, really strong skill set. But that brings us here. Why should we care? I started out by asking you what public health was. And you said, bottom line, it's the health of the public. That's exactly right. That's why I'm guessing that all of you want to go into health, because you want to help others. Well, we have a lot of work in front of us, especially here in this region. The video that I'm getting ready to show you, this is our dean coming back. I wanted to start with him and end with him. And this is him talking about what it looks like, the health status of this region. You have an exciting opportunity being part of those that are being trained in health, being trained where you're getting all of this wonderful formal education right now. We are in an area that is absolutely rich when it comes to culture and heritage and connectedness, but we also have struggles in that we live in a place in America, and even some places here around us rival third world countries when it comes to health status. So being able to go out and work in that and think through ways to improve this community is a very exciting thing for all of you. I'm going to let this video run, and then after it, we'll finish up. It's about 19 minutes. I know, sorry.
Well, good morning. Can y'all hear me okay? In the back, great. I'm Randy Wyckoff. I'm the Dean of the College of Public Health here at East Tennessee State University. And I'm going to be trying to give some specific details about the health status of our region and to compare it to Tennessee as a whole and to the nation as well. Now, today I'm going to pose and answer two questions, and hopefully by the end of this entire session, not just my presentation, but the panel discussion and the speakers to follow, we'll be able to answer both of these questions. What is the health status of our region, and what can be done about it? All right? Now, for the purpose of today's talk, I'm going to focus on just a very small part of our nation. There's 3,141 counties in the United States. And I'm going to be talking about just the 8 counties of Northeast Tennessee. But if any of you are from Southwest Virginia or Western North Carolina or another part of the country, I can assure you the details of what we're talking about are exactly the same everywhere. You can take what you learn here today back home to Southwest Virginia or Kentucky or North Carolina. But for purposes of today, we had to pick one area. We're going to focus on these 8 counties, the area that we call home. It's a region of incredible natural beauty and remarkable culture and heritage, but it's also a region that faces very significant health challenges. Now, to understand the health challenges of our region, I want to take a step back and talk about the health status of the United States as a whole, because once you understand that, then you can compare our region to Tennessee and Tennessee to the nation. And typically in public health, when we're talking about the health status of a nation, we talk about life expectancy. It's the most basic fundamental measure of health. If you think about it, everything that goes into your life is reflected in life expectancy, right? How old is your mom when she gets pregnant? Does she use nicotine or alcohol or other addictive substances? Are you born in a safe environment? Do you have clean water and abundant food? Can you get an education? Can you get a job? If you get ill or injured, can you get access to health care? All of those things times 310 million make up life expectancy in the United States. And if we went out on the streets of Johnson City and we asked the man on the street to tell us 2 things about life expectancy in the United States, the first thing he would likely tell us is that life expectancy in the United States is now the longest it has ever been. And the man on the street would be right. In 2014, life expectancy in the United States was 79.5 years. A baby born today in the United States is estimated to live almost 80 years. The second thing the man on the street is going to tell us is that life expectancy in the United States is probably the longest in the world. He knows that we spend 50% more per person on health care than any other country in the world. He knows we have a health care infrastructure that's the envy of the world. But here the man on the street would be wrong. In 2014, the United States ranks behind all of those countries and comes in 33rd in the world. All right, 2.5 dozen other countries do better at this basic measure of health than does the United States. 2.5 dozen other countries where a baby born today is projected to live a longer life than a baby born in our country. And as worrisome as that is, if you look at early death rates across all 50 states, you'll see Tennessee way down there at 43rd. So here we are living in the state that ranks 43rd in the nation that ranks 33rd in the world. Okay? But as worrisome as that is, remember, our region makes up less than 10% of the population of Tennessee. So if we really want to understand the health status of our region as a set of 8 counties, we have to look at something other than Tennessee's statistics. And we've developed a way of looking at statistics here at ETSU that I hope helps put our region into a national context. So what we've done is we've taken all 3,141 counties in America using the county health rankings, all 3,141 counties, and we've laid them out by their premature death rate, their early death rate, from the healthiest county in America all the way to the least healthy county, okay? There's the median county, 50th percentile, has a value of 77.20. Don't worry what the number means. It's actually years of productive life lost before the age of 75 based on 100,000 population. It's just a measure of early death, which of course contributes to life expectancy. Now, because you can see the line is pretty level between the 10th percentile and the 90th percentile, I'm going to drop the top and bottom 10% off. And I'm going to change the scale on the left. Now this is the, if you will, the middle of America. This is the 80% of the typical counties in America. Does that make sense to folks? That's the 10th percent healthiest county, that's the 10th percent least healthy county. Again, the same average rate. Now what I'm going to do is take all these counties in America. There's Tennessee. Again, remember, we're below the national average. We're 43rd in the nation. And here are our 8 counties that we live in. And what you can see is that 100% of our counties fall in the bottom half of America for life expectancy, and all but one of our counties is below the Tennessee rate. So here we are in a region where our chance of dying young is considerably lower than the state that ranks 43rd in the nation that ranks 33rd in the world. All right? So I started by posing 2 what questions. I suspect most of you now are not asking what, but why. Why should someone born in our region be any more likely to live a shorter life and die younger than someone born in most other states and in dozens of other countries? Why do we have health statistics in our region that are so much less than we could achieve? And I say we know we could achieve it because other states have, right? Why do we have health statistics in our region that are worse than we could achieve? Well, again, it's helpful to take a step back and ask what we know about why people die young in the nation as a whole. All right? In the New England Journal of Medicine a few years ago, they published an article that identified the 5 factors that cause us to die young. Not the leading causes of death. We know that 2/3 of Americans, 2/3 of us will die of one of 5 causes, right? Cancer, heart disease, stroke, chronic obstructive pulmonary disease, or unintentional injury, accident. 2/3 of us in this room will die of one of those 5 causes. But what are the factors that cause us to get those diseases? That's what this article addressed. 1/3 of it's genetics, what we inherit from our family. A small amount is due to environmental exposures. Another larger amount is due to the conditions in which we live. That leaves 2 wedges in the pie. People are often surprised to learn that the smaller wedge is healthcare. What this means is that if all Americans had access to the very best healthcare, which they do not, we would reduce our early death rate by about 1/10. Now that's really important, and we have to figure out a way of doing that. But the big item here, of course, is behavior, the things we do ourselves. Right? This is what the New England Journal says we're dying from as a nation. So it's reasonable to ask, okay, what do we know about these factors for our region? Right? Which of these is causing us to die young more than Tennessee and causing Tennessee to die young more than the rest of the nation? Now, that's the real question. What about genetics? Now, you may think, well, that's kind of a weird thing to ask. But, you know, there's at least a theoretical reason for it. If you look at the distribution of Scots-Irish in America, for example, we have a clustering here. And maybe there's something about being Scots-Irish that causes us to die young. I hope not. But there's at least one piece of information that suggests that's not true. Bess Brown Cooper, who some of you may have heard of, was born in Sullivan County in 1896, graduated from ETSU in 1916. For 18 months, she was the world's oldest living person and one of only 8 people ever known to reach the age of 116, which proves absolutely nothing except to suggest that maybe it's not genetics that's causing us to die young in our region. Well, maybe it's healthcare. My apologies to our colleagues, but maybe our healthcare in this region is not very good, and that's causing us to die younger than the rest of Tennessee. All right? Well, every year the county health rankings rank all 95 counties in Tennessee, and one of the areas they use is clinical care. And the top 5 counties in the state include our 2 flagship counties here. So if we're among the best counties in the state for clinical care, that's probably not the reason why we're dying young in our region, okay? What about behaviors? Well, the Centers for Disease Control tell us what these behaviors are, the behaviors that cause us to die young. It'll come as no surprise to any of you that tobacco is number 1, followed by obesity, and then the numbers drop off pretty quickly: alcohol, infectious diseases, pollutants, motor vehicles, self-explanatory, firearms, self-explanatory, sexual behaviors that leads to AIDS and other diseases, and illicit drug use. These are the things the CDC says we're dying from. Well, let's just take a look at a couple of them and ask whether our region might be, our poor health status in our region might be attributed to this. Well, tobacco, if you look at smoking nationwide, there's Tennessee all the way down there at 46. Almost a quarter of our adults continue to smoke. 60 years after the Surgeon General identified it, is the leading preventable cause of death in our country. If you look at all the counties in America, there's Tennessee. 100% of our counties fall below the national average, and 100% of our counties fall at or below the Tennessee rate. So clearly, if we're looking for a behavior that's contributing to our poor health in this region, nicotine addiction is certainly part of that. What about obesity? You've heard about the obesity epidemic. Tennessee's 47th in the nation, the 4th most obese state. 1/3 of our adults in this state are obese. If you look at all the counties in America, there's Tennessee. This is one time where our region is not much worse. In fact, we're worse than the nation, of course, but about maybe even a tick better than the state as a whole. Now, if there's any media here, I don't want anyone walking out of here saying, Dean of Public Health says obesity not problem in region. All right? Obesity is a major problem. It's the 2nd leading preventable cause of death, and our region, if anything, is just slightly better. But clearly, if we want to improve health, as Jerry mentioned, we have to talk about personal choices and behaviors, okay? We have to change behavior. Now, 10 years ago, this is where my talk would have stopped. I would have said, folks, we need to go out, help people change their behavior. But we're increasingly coming to understand the importance of this, the social circumstance, the conditions in which people live, what we call the social determinants of health. And it goes like this. Our health is based in part on our genetics, what we inherit from our family. It's in part based on access to health care. It's in part based on our behavior, but it's also in part based on the conditions in which we live. And if you look at that list, everything up there will make some sense to you. You can understand how those things impact people's health. But what you may not understand is how much they impact health. So I'm just going to talk about 2 of them. The first one being income. Poverty. How does poverty impact health? Well, here's children living in poverty. There's Tennessee down there with over a quarter of our children living below the poverty line. All right? If you look at all the counties in the nation, there's Tennessee. All but one of our counties are worse than Tennessee overall. This should matter to us for 2 reasons. One, it matters because poverty is very tightly bound to health care, to health outcome, okay? I could show you a lot of slides. I'm just going to show you one. This says, what's your chance of dying before the age of 65 if you're rich or if you're poor in America? And what you can see, if you use the relative risk of 1 for the rich, a poor American is 3 times more likely to die before the age of 65 as a rich American. In our country today, something as basic as life expectancy is so dramatically impacted by health, by income, okay, by poverty. The second reason this matters to us in this region is that there's evidence that in our country, the gap between rich and poor is widening over time. This is information from the Census Bureau. It looks at the poorest 1/5 of Americans and the richest 1/5. And without going into details, what it shows is that from 1971 to 2011, the actual buying power of the poorest 1/5 of Americans went up by 8.5%. During the same time, the richest Americans went up by 51%, so the gap widened by 39%. And why do I tell you this? I tell you this for this reason. If you believe, as I do, that poverty is tied to health, what this means is that parts of the country with more poor people are going to see a widening economic gap and therefore a widening health gap over time. And what that means to us who care about improving health is that we've got to have economic development. We've got to create jobs in the region because that's really going to be essential to changing the health status of the region. The only other one I want to show you is education, in part because that's the business I'm in. and it pays my salary. If you look at high school graduation, this is one time where Tennessee's actually above the national average. Think about this. In 2005, Tennessee ranked 49th in the nation for high school graduation. Now we're above the national average. That's pretty impressive. And that also tells you that everything I show you up here can change. All right? Nothing about this is unchangeable. But if we look at, now I have to change to some college, but that's just the data that I have. It's very comparable. So there's Tennessee, slightly better than the national average. And here's the counties in our region. 3/4 of our counties fall below the national average. All but one of our counties falls below the Tennessee average. This should matter to us for two reasons. One, education is linked to health. I could show you a lot of slides. I'll just show you one. This is how many more years you're going to live by age 25 based on your educational achievement. Men, women. High school dropout, high school graduate, some college, college graduate. All right? The difference is years, 5 to 7 years. If you know someone who's in high school today and they're thinking of dropping out, you can tell them on average, if they graduate from a 4-year institution, their life expectancy on average goes up 5 to 7 years and their lifetime income is over $1 million increased. It's a good investment to get an education. But it also should matter to us for this reason, and that is just as with income, there's evidence to suggest that there's a gap, the widening gap between educated and uneducated places in the country. This is a simple chart that looks at high school sophomores and says how many of them will have a college degree in 10 years. Well, if their parents are professional, 3/4 of them will have a college degree in 10 years. If their parents are high school dropouts, less than 6%. A 12-fold difference. What that means is that parts of the country that have lower rates of educational achievement will see a widening gap in health and education, and therefore a widening gap in health. And what that means for those of us who care about health is if we want to improve health in this region, we've got to get more kids through high school and more kids through university. We've got to get a better educated workforce. All right. So I could talk about a lot of other things on this chart. I'm not going to right now. It all comes down to this next chart, okay? If we want to improve health in our region, or if we want to improve health in the United States, we have to focus on three things. Yes, we have to make sure people have access to affordable quality health care, including preventive services. We've got to encourage the kind of choices that help people make good behavior change, but we also have to work on jobs and economic development and education. And the single most important thing I'm going to tell you is this. These three things are intertwined and cannot be separated. We will not be successful at any one unless we're successful at every one. You ask any business leader here and they'll tell you the number one thing they need is a healthy, educated, drug-free workforce. You ask any educator here, they'll tell you they need kids and parents and teachers that are healthy, but they also need a robust tax base to support the school system. You ask any healthcare provider, they'll tell you they need people who have the education to make good health choices, but who also have the income to invest in their choices. Okay? The most important message I can give you is that these things have to happen together, and that's why this group is here today. All right? Health improvement isn't just healthcare, it's not just economic development, it's not just education. If we want to be successful, we need to work together to assure access to health care, especially preventive services. We need to work together to encourage healthier behaviors, and we need to work together to enhance economic opportunity and improve educational achievement. And what do these three things have in common, of course, is we need to work together. These are not problems that Washington, D.C., or Nashville, or Johnson City can solve on their own. These are not problems that Republicans or Democrats or Libertarians or Socialists or anyone else can solve on their own. But most importantly, these are not problems that economic development, education, and healthcare can solve on their own. We've got to work together. If we work together, if we get business, education, and healthcare together, we can improve health in every part of the nation. Every state in the nation will benefit, but probably nowhere will benefit more than we do here in our 8-county region. I often say I've never been anywhere where there are more people who want to improve health than here in East Tennessee. I've been here for 8 years. I love this region. I'm incredibly honored to be at an institution like ETSU. But I close with this slide to tell you that's my great-grandfather. He was a public health officer in Virginia 100 years ago. That's my son Kevin, that's my son Greg, my daughter Kathleen. They're both students here at ETSU. And I close with this slide to make a simple point. And that is nothing that I've talked about has anything to do with politics. It has almost nothing to do with public health. It's really about whether or not we, as the leaders of this community, can make the kind of decisions that we need to make to give our children and our grandchildren a region that is as healthy as it is beautiful. I'm incredibly honored to be a part of this panel here today. I think what we're doing today is exactly the way to move forward. We've got to have educators, business leaders, and healthcare together at one place at one time.
All right. So Dr. Wyckoff does such a good job of bringing it all back and showing, and how he was thanking that crowd right there of just being committed to being leaders around health. I want to thank you for committing to health, coming into ETSU, designating yourself as pre-health, and that you're all sitting here means that you're committed to that. So thank you very, very much. Thank you for letting me talk to you today about public health in general, and then actually the College of Public Health. Here's some contact information. I'm going to start with who I have with me, Miss Dara Young. Dara is the advisor for microbiology and for human health. We also have Miss Taylor Dula, who is for the Bachelor's of Science in Community Health and Health Administration. Her contact information's up there. You can also look it up at the ETSU website. Dr. Meyer and Dr. Schuerman, they're for environmental health. This is Billy Brooks, Dr. Bill Brooks, I should say. He is serving in the MPH role, so even if you're thinking a little further down the road, you can contact him and talk about the master's program. And then that's me, obviously a long time ago, but you can contact me at any time. So I want to put this to you guys, is that I brought with me a CDC health IQ quiz that I thought we could play together. Or, if it's okay with Martha, or you guys can hit the road. So by show of hands, and I have such a thick skin, so you're good, is who would like to play the IQ game for about 5 minutes? Anybody? Awesome. That's great. All right. I'm not even going to ask for a show of hands of who would like to leave. Thank you very, very much. I appreciate it.